Hi, I'm Dr. Steve Newman, Executive Chairman and Chief Medical Officer of CentraForce Health. I've spent my career taking care of patients and managing health systems. Today, I hope to show you how the solutions of CentraForce Health really can help change the way you care for patients and improve your business performance. As you know, all payers have challenges each and every day. And one of those challenges is making sure your members stay as healthy as they possibly can. Keeping them out of emergency rooms, out of hospitals, out of physicians' offices not only improves their quality of life, but drives down your cost of care and improves your business performance. So having run a Medicare Advantage plan a number of years ago in New Orleans, I share with you the frustration of every January 1st when through open enrollment, you have a whole new population of members that you know nothing about. There is a mad dash to try to collect the answers to 50 questions for each of your patients. And if at the end of 6 months we have half the patient having answered half the questions, we call that success. With CentraForce Health unique new member assessment solution, it is easy for you to gain insights about your new members. Within 30 days of their enrollment and you're sending us a small amount of information on each new member, we're able to turn around to you data, information, and insights that basically answers over 700 questions about this new member. This translates to dramatic cost savings in two ways. One is you save on salaries for those that you would use to ask and get these questions partially answered. On the other hand, there are dramatic savings in identifying undiagnosed chronic disease. So those insights in new member evaluation help you pinpoint those individuals that need your intervention and attention immediately, thereby keeping them out of the emergency department, out of the hospital, and much healthier. That improves your bottom line and lowers your medical cost ratio. One of the extra benefits our payer clients receive with our new member evaluation solution is the customization for each of their members. Being able to reach out to an individual member and address his or her specific risks or issues, whether it be a transportation risk, whether it be an isolation risk, really opens the door for a more secure, more fulsome relationship between your new member and your organization. Our new member assessment and care coordinator solutions really help your staff customize the care to your individual members, knowing what risks to address with each member and the urgency to do so translates to fewer emergency room visits, fewer admissions to the hospital, fewer surgeries. In fact, you're able to avoid acute and sometimes even chronic disease with this prospective intervention in those patients that previously were thought to be healthy. So our payer clients tell us that they have continuing challenges in trying to manage their entire population. But they're forced, because of lack of information and insight, to manage most aggressively those that have claims. The reality is, each and every day, by ignoring those that don't have claims, the ones I call the invisibles, what you're setting up is the creation of new members that develop acute and chronic disease that contribute to that 15%. During my career as a practicing physician, and I'm sure yours as either a physician or a health executive, you've been incredibly frustrated by the fact that we're spending all of our resources, 85% of our total resources, on 15% of the population that we're responsible for. Unwittingly, we're ignoring that 85% of the population. I refer to those people as being the invisibles. They're not invisibles because they're healthy, because we at CentraForce Health know that they have very risky behaviors, attitudes, interactions with the healthcare delivery system, which puts them into the category of ticking time bombs that are going to explode, and rapidly those seemingly healthy individuals come into the bucket that we spend all our resources for and not make any progress in keeping our populations in general healthier. By utilizing our rising risk solution, for the first time, you are able to concentrate on those patients, those members that have not yet had claims in your system. That insight, that ability to stratify risk and identify those that are going to be ticking time bombs that could have a health catastrophe can dramatically diminish your cost of care and improve your business performance. So you might hear us say that our solutions provide for you the benefit of speed and ease to actionable insights. What that means is that they seamlessly fit into your daily workflows. And we know from talking to our payer clients that adding something new to the desktop is really something that they shy away from. The beauty of our solution is that it's accessible in the cloud with a simple browser on the desk of a care coordinator, a care manager, a nurse, or a physician. The bottom line is these unique CentraForce Health solutions help you as a payer improve the clinical outcomes of all of your patients, driving down the cost of care and dramatically improving your business performance. Thank you very much for watching this video. If you found it interesting and intriguing, we'd love to have a conversation with you. We can set that up if you just press the button below, and we'll set up a conversation where we address your specific needs in your organization.